is Ben Gomez, and I'm going to be demonstrating the PA chest and lateral chest projections for my pathology congestive heart failure. Okay, once I obtain my patient, I'm going to use two patient identifiers to obtain her, name and date of birth. Once I bring her back to the radiology department, I'm going to have her change everything from the waist up off, all necklaces, jewelry, piercings, everything off in the thorax area. And once she gowns up, I'm going to bring her into the room, close the door, and then I'm going to obtain patient history from her. Questions such as what kind of problems is she having, what symptoms, how long she's been having them, chest pain, does she have chest pains, hypertension, any recent surgeries. So is there, any problems in her family, maybe hereditary, that she could have also? Once I obtain those, I'm going to make sure she's not pregnant, and if she says she's not pregnant, then I'm going to get the first day of the last menstrual period. And then I'm free to start positioning my patient for the PA chest. So I'm going to have her come over to the board, stand chest against the board. Going to use a 14 by 17 image receptor lengthwise with the ID blocker at the top. That way it's not in the lung field. Okay, so positioning for this, first of all I'm going to position in an honorable center. So positioning, I want her to raise her chin slightly, roll her shoulders forward, place her back hands against her hips, and her arms against the bucky so as to keep the patient's shoulders rolled forward. That often helps. So my centering, once I have the patient positioned and shielding in the back, I want to make sure that I center correctly, and that is at T7, and that can be found by going to the inferior border of the scapula, or 7 to 8 inches below the vertebral prominence. So that's exactly where we're at right now. Now, once I have my patient positioned, I'm going to mark left side. At her left side, I'm going to measure my patient. (24 centimeters), and I'm going to set my exposure factors for 24 centimeters. And I want, for this projection and the lateral, I want to be at a 72-inch SID. That way we reduce the magnification of the heart. Okay, so my collimation is to the skin borders of the patient so that we do not clip any anatomy. I want to expose on second full inspiration after I have set my exposure factors for her for the centimeters that I stated, which was 24. Okay, so I expose on second full inspiration. All right, now we're going to go to the lateral chest exposure. So go ahead and relax. I'm going to change my image receptor. Also, it's going to be portrait with the ID blocker at the top. I'm going to turn the shielding on the patient so that it's facing the radiation. Okay. Now I'm going to position my patient straight so the mid-coronal plane is perpendicular with the image receptor, and I want my patient to stand as close to as possible to the image receptor without bending or twisting. So, and I want my patient to put her arms above her head. That way the humeruses are out of the way. I'm going to mark on the left side, centering at mid-coronal, and T7. Same thing. All right. I'm going to ensure that the light is around my patient on the anterior and posterior aspects. I'm going to place my hand on the back of the posterior ribs to make sure that they are superimposing. I measure my patient, and I'm coming out with 33 centimeters at the central ray. 33 centimeters. I will set my exposure factors accordingly. I will expose on suspended second full inspiration. That is the lateral chest.